and start the
This
recording.
meeting is being recorded.
Can you all see my screen there?
Yes.
Yeah, that's fabulous. Thank you. So as usual, we'll be recording the meeting. If you don't want to be recorded, you can turn your camera off. You can put any questions in the comments and we'll keep an eye on there. Here's the agenda, just 3 items. We've got Steve giving our usual COVID update, Darsha will give us an NHS vaccine update, and we have a guest speaker, Matthew, who's going to tell us a little bit about the Year of Culture. So over to you, Steve.
Okay,
Oops.
thanks, Tracy. No, it's fine. You can leave it there. So I'll go through the data and then I'll just update everyone on some changes that we've were announced late last night and will continue to be announced over the next few days. If I start coughing, that's because I was ill last week, and quite remarkably, I displayed all the symptoms of COVID, LFT negative, PCR negative. So there are other bugs available, which is something to be mindful of. I guess we'll probably all know people who have been infected at the minute with various things. So just a couple of caveats before I get into the data slides properly. It's worth understanding that we never fully have got a total understanding of the amount of infection there is in the population, but at the minute our understanding is less than it has been. And I know I've mentioned this over the last few calls. I won't stress this too much, but we just need to be careful of not comparing the rates with what's happened in the past. Just look at the general trends is more important, I guess, at the minute. So if you move on to the next slide, please. And so these 3 charts going from left to right. The one on the left is the cases, the number of cases we have in the population by 100,000 people in the last week. Wakefield is the blue line, England's the yellow line, West Yorkshire is the grey line, which you can see. First of all, you can see that Wakefield and West Yorkshire are pretty similar as far as we understand it, and we are slightly lower than the national average currently. But the important thing to understand is that line has turned north and it's going up fairly quickly. So you won't be able to tell exactly what that number is, but it's probably around 600 per 100,000. But we do think that's an underestimate. And you can see this, the middle chart is the positivity. So that's the number of people whose tests come back positive as a proportion of the whole people who get tested. And again, that's gone very steeply uphill, which suggests that there's quite a lot of infection out there. And if you test a lot more people, you'd find a lot more cases. And the one on the right just shows that even though cases have gone up significantly, the number of tests are still quite low. The last time we were testing this amount of people was probably summer 2020. So we are in this stage where we've now got what's clearly another upwards rise, a wave, if you like, but we don't have as much detailed information as we are used to. So we'll come back to that. But if you move on to the next slide, please. I'll try and skip through some of these fairly quickly, but this is an important one because this is the Office for National Statistics Infection Survey. So this is a weekly survey by the ONS, and we can't see it at Wakefield level, but we can see what's happening at Yorkshire and Humber level. And all the little charts on the right hand side show what's happening across different parts of the country. So Yorkshire and Humber is at the bottom row in the middle, and you can see we are now going upwards, and we are around 5.5% of people are testing positive in Yorkshire and Humber. Put it another way, that's something like 1 in 20, maybe a bit more than that actually. Probably something like 1 in 16 people are positive, which is a lot. That's a high number of people. But if you look at the southeast and south west and the east of England, you'll see rates there at 7.5%. So there are still some areas, I mean, significantly high rates of infection. We're probably moving towards a peak of this wave, but I'll just come back to that in a second. So if you move to the next slide, please, Tracy. And what's behind this rise is probably 2 or 3 different things. So what this chart shows you is what's happening with the BA2 variant. So as I think I've explained before, Omicron itself comes in a couple of different subvariants. The main one that causes problems in December and January was BA1. BA2 is slightly more transmissible. It spreads a little bit more readily than BA1, so that gives it an advantage, and it's now taken over. And probably in England, about 80% of all cases are now BA2. It doesn't change anything else. It's not any more serious. It's not any less serious. It's just taken over from BA1, and that's one of the reasons why we've got this rise. Of course, one of the other reasons is that pretty much all restrictions are off. So we're back to running society as the pre-pandemic phase. There'll be certain groups who are maybe a little bit hesitant. Maybe still people are washing their hands or avoiding crowded spaces or wearing face coverings. But by and large, we're fairly much back to normal. So with a transmissible infection and this and no restrictions, then we have this upward trend. The other reason, maybe because of slight starting to wane of immunity, because we had, when we knew Omicron was coming, there was a big rush to get everybody boosted. You might remember that November, December time, rush to get everybody boosted. And what that means is that a lot of people will start to become susceptible at the same time as immunity starts to wane. What we don't want as a nation is to have these big cliff edges where everybody's immunity starts to fall off at the same time. So over the next period, the booster program will be rolling out in the more high risk groups, but it won't be done in a big rush. It'll try to be slow and steady, which means that in future we won't have these big cliff edges. But if we go on to the next slide, please. I'll skip through some of these because the data isn't that robust. But what you can see here by ages, the most infections we're seeing, as far as we understand it, are in the kind of working age adults, 25 to 60-year-olds. And if you keep flicking through the slides, Tracy, you'll see these are the charts that show the different ages. The last one that you see there, that's young people. So you see that steady increase, but not as dramatic as some of the others. But of course, we've got the Omicron peak numbers there. For 17 to 80s, for example, we reached over 4,500, which is a very significant high level of infection in the first Omicron wave, which might help suppress some of the transmission in this wave because there may be some natural immunity. But so that's where we are with age ranges. Everywhere seeing some increases, and by deprivation, by and large, it's the same picture across everywhere. Slightly more cases evident in the least deprived areas. That's probably not a reflection of reality. That might be a reflection of people wanting to get tested and being able to cope with isolation. So if you are if you've got a job that requires you to be in and an employer that doesn't want you to isolate, then you might not get tested. So you might have symptoms. You might just carry on regardless. So there's some reasons why that data isn't necessarily describing the reality, really. And if we move on to the next slide, I'll just skip through these. These are just probably for information, showing how testing has changed. But this one is important. So this one shows the number of people in hospital. The blue lines are Wakefield residents, and the red bar is non-Wakefield residents. But you can see the totals, and you can see the totals have been increasing over the last few weeks. Now, what we do know is that when infections go up a few weeks later, admissions start to go up, and people need go into hospital with COVID or go into hospital for other reasons and are test positive whilst they're there. So what you can see is if we see an increase now, it means rates were going up already 2 weeks before this. So we expect to see this rise continue for a few weeks. Very hard to work out where the peak will come, but it's maybe approaching the Easter weekend. So that's some kind of bit of guesswork. But if you move on to the penultimate slide, is the one that where we chart the deaths from COVID, and you'll see even though we've had increases in cases and we've had increases in admissions, we're not yet seeing the number of deaths increase, which is really, really good. Clearly, we're still having small numbers, But there will, and we may see some increase because of the number of people going into hospital. But actually, given people's immunity and the high level of boosters and vaccines, plus better treatments, then we're hoping that we'll keep it at a low level, which is one of the reasons why we're kind of moving into this living with COVID kind of territory now. And I think the last slide on the data slides is just the vaccination overview, which you can see very good progress, lots of green in there. Clearly, we still want to encourage anybody who is eligible to come forward and have their first dose, their second dose, their third dose, their booster, wherever you are. It's never too late to start to get vaccinated. So that's and that will continue to be an important point. But before we move on to questions, if I just carry on talking about the guidance that was announced, it came out late yesterday, largely around what's going to happen from the 1st of April around testing and particularly isolation. So the big headline is that free testing from the 1st of April for the general public stops. So there was no longer free access to testing. So and in terms of what you should do if you develop symptoms that are like COVID, then basically if you develop any symptoms that are like a respiratory infection, so like if you have a new cough and you've got a high temperature, then and you feel unwell, then the advice is to stay at home, limit contact until you're well enough to go out and your temperature's disappeared. So if you've got a high temperature, you should be trying to stay away from people, stay in the home until that disappears. If you do go and get a test, so if you do go, you can buy tests from the 1st of April. So if you do that and you test positive, then you should try and avoid contact for 5 days. So you're not legally required to isolate, but that's the case for most infectious diseases. If you do need to leave home, then try and do that in a way that limits your chance of infecting somebody else. So wear a face covering, avoid crowded spaces, and avoid contact with anybody who might be vulnerable. So if you do, for example, if you've tested positive, you need to go to the shops because you need to buy some food, then try to do that at a time when it won't be as busy. Just trying to be sensible on some of that. There will still be testing available. So for anybody who's symptomatic, that will change. So if you need hospital care, then you will be tested with a PCR test, and those will still be sent to the national labs so that they can see what any variants. So that's one way we'll continue to measure whether any new variants are created problems. If anybody is on the antiviral list, so that's the people who are clinically extremely vulnerable to COVID, you now should be identified as somebody who could get antivirals quickly if you test positive. The plan, we haven't got all the detail on this yet, but the plan is for all of those people to have a stock of LFTs to be kept at home. So if you develop any symptoms, you can rapidly test yourself. If you come back positive, you can then go and get your antivirals. LFTs are not always perfect, so we're waiting to see some of the details on the guidance because they can miss positive cases. And there will continue to be testing available for high-risk settings. So not every setting, but places like care homes, domiciliary care, NHS staff, hospices, prisons, all will still have access to some degree of testing. But the general asymptomatic testing, so the general LFTs, they won't be available free of charge, but they will be available to, again, some high-risk settings whilst we've got lots of infection in the community. So again, some of those places that I've mentioned, but as well as domestic abuse, refuge centres and any homelessness settings. So anywhere that's working with people who are particularly vulnerable. The guidance for children is we wait to see the headlines on this, but it sounds like if children are unwell and have a high temperature, they should not go to school, and they should stay at home and return only when their temperature comes down. But we don't have the full detail on special school settings yet. And then the last thing just to mention again, we're waiting some more guidance on care homes. But at the minute, care home visiting, as you'll be aware, you need an LFT to access a care home, and we expect that to disappear on the 1st of April. We will, so most visitors, including care homes, but also NHS settings, won't need to have a test, but we don't know that for certain. We will have to wait and see, and we have been told to expect the full set of guidance in the early hours of the 1st of April. So, we'll all be up late reading those, no doubt. I think that's all I've got on that at the minute. There will be a period where some of the guidance will be contradictory whilst it all gets changed online, but we'll just have to deal with that as best we can. I'll pass back to you now, Tracy.
Thank you very much, Stephen. Yeah, 1st of April is a perfect day for some new guidance from the government. Does anybody have any questions for Steve?
Steve, Mr. Excites, I've got one question. So if you're using lateral flow tests and you have to then self-isolate for 5 days, are you expected to do a lateral flow test every day until it is showing as negative?
Probably not, to be fair, Nick. So if you test positive on LFT, then you will be advised to stay at home and for 5 days. But there'll be no requirement to do any further testing. And I wouldn't, if I tested positive, I would wait 5 days before I did another test anyway. You shouldn't really test daily until day 5. But the guidance, we don't know the full detail, but I suspect the guidance will be if you test positive, then you'll just have to wait for 5 days. As long as you don't have a high temperature, then you can resume normal activity.
Okay, brilliant. Thank you.
Thank you, Nick. Does anyone else have any more questions?
Yes, I do. I'll just turn my video on. Yeah, I'd like to ask a simple question. What is a high temperature?
We've asked the same question in our team meeting this morning, Richard, and not only that, but particularly for children, who's going to be doing it and what device are we going to be using? So I'm not a big fan of infrared devices, but you can imagine the scenario when the child goes to school and the teacher says, well, they've got a high temperature. Well, they were fine when they left this morning. So does the teacher take it? There's lots of unknowns, and we've always been, and this focus on high temperature is quite a change, because in the past it's been there as a symptom to prompt testing, but we've always advised places that have tried to screen people on admission not to do it, because you can get false readings, you get many false positives, many false negatives, and if you're 0.1 of a degree over, does that really make a difference? We're concerned about how that will play out, and so we will wait to see the detail of that. It's very vague, I have to say, Richard.
Okay, thanks so much.
And I'm presuming as well that our communications team have really been on it, and when there's been a change in any legislation or guidance, our comms team are really quick to put that in a format that people can understand, and we'll share that via email. Yeah,
we've got a meeting booked in on Friday with a range of people, including our comms colleagues. So we'll pick it up on Friday as well.
Thank you very much, Steve. Thanks very much. So if there are no further questions, and you can always email any questions outside of the meeting, but thank you ever so much, Steve, because I know you've not been feeling so well. So thank you for coming. And we're over to Dasha now, please.
Thank you, Tracy. This one is a quick overview of those who are eligible for vaccine. And as Steve was saying, it is very important to have the vaccination. We are absolutely encouraging and continuing to encourage people to take it up, whether it's your first, second, third, or a booster. At the moment, we are still looking at what is available or what we can be offering at this very stage. So it's anyone aged over 12. Children aged 5 to 11 currently is still at those who are at higher risk, but we are still putting into plans and aiming for early April in terms of widening that to the rest of 5 to 11-year-olds. Some of the changes also coming up in terms of the spring booster. So those who are age 75 or over, and also we will be vaccinating in care homes for older people as well to receive a spring booster, and those who are age 12. In terms of those who are immunosuppressed, they are being invited via the NHS, so they will have 3 primary boosters as well as primary doses as well as a booster, so they will have a few more. If we have a look at the next slide, Tracy, we've put just a quick overview of a few links with information in terms of where to get a bit more information on the clinics. So as always, our CCG website does have the up-to-date information on clinics that are running. We are updating it, and we are anticipating as beginning of April comes that there will be more information. If you want to have conversations in the community and just to help you answer some of the questions, I've put a link directly to the frequently asked questions, and one is specifically around children and young people, and one is about boosters. And on the last slide is just a quick reminder, we are approaching Ramadan, and we do have some communications tools and some images. If it is helpful for your newsletters or other materials, if you want us to share it, we can do. And it's really reminding that COVID-19 vaccinations are safe. They don't contain animal products, and how it fits within Ramadan fast. So I can see there are a few charts, and apologies if you can hear any rain in the background. I am sat in a car, so I'm hoping you don't have a very relaxing background music. Where can we get a 4th booster in Pontefract? The vaccinations around the area are still running from local clinics as well as GP practices from GP centres. I'll put the link into the chat, and it can show you some of the clinics that are running, but also for those who can or may not be able to use internet, NHS the 119 service that also gives information around the clinics that are available. Anyone can also use the online service via the NHS to search for the most appropriate clinic that is most convenient for you. Will carriers of immunosuppressed people be also eligible for a 4th booster? The 4th boost, the booster, which is the 4th dose that a person would have, is for an immunosuppressed person. We are looking at the eligibility of those who will be eligible for the springtime booster as well, and we are looking at currently the 75 plus and those in care homes, but we are also awaiting more operational guidance as to how the cohort might be increasing as well. One of the things that Steve mentioned also is about the gradual rollout, which is something the spring booster will be looking at as well, and also how we can bring some of the other cohorts into booster program as the months go along. So I will promise to share the information about the different clinics. I know John asked that. Hello, John. It's nice to see you. I've only just spotted the name. And I will put a little bit more information around the boosters and eligibility.
Thanks very much, Dasha. And that's going above and beyond parking up, so you can get a signal to to be on our meeting. Thank you so much. What a trooper. Thank you. And we've got another trooper now. Matthew, who's not been feeling so very well either, but he's come along to tell us a bit more about the Year of Culture. So over to you, Matthew.
Oh, thanks, Tracy. So I'm here from the Culture Department of Wakefield Council, and correct, I have a cough. I'm working from home, so apologies if I do cough as I'm speaking. So I'm here to talk about the Year of Culture. As some of you may know, we tried to bid for the City of Culture, but we weren't successful. Our neighbours in Bradford were longlisted, but there was great enthusiasm for us to be working towards something. So we set up with the ambition of the Year of Culture 2024 for the whole of the Wakefield district. And I'm here just to quickly ask you for your support and to go out to your communities that you're all members of for our conversations that we're running next week across the district. We're currently working with a consultant called Maria Bota, who has worked on the Yorkshire Festival and many national festivals and international festivals. And we're coming up with a roadmap, and it's giving us a bit of light to look forward to for 2024 to really celebrate Wakefield. And we're going from a different space of not just these are the big events we can give people, and doesn't that give us a sense of pride, but actually what's already happening and what can we help to enhance, bolster the things that are happening already across the district. Because we want it to be a celebration of Wakefield. So there will be the big events, but we're really trying to focus more than ever before on the voices of Wakefield, the stories of Wakefield, and of course the people of Wakefield. So we're currently next week having 4 conversations in South Emsall, Wakefield, Pontefract and Ossett. And it's an event from 6 till 8, and it's a structured conversation. So it's coming from our learnings of community development. So we're asking for people for what their dreams, what their ambitions, what already is going on in their areas. And so I think you've already been maybe an email from Tracy, but this is just my encouragement to you all to either join yourselves or to pass it on to people that you might know of. And you don't have to be involved in culture. Culture, of course, is everything. It's more than just the arts. It's our way of lives. And so I can pop into our chat. I'll just do it now. The Eventbrite bookings, because we're asking people just to book on so that we can manage those numbers and capacities within the buildings that we're working from. But it's an open conversation about ambitions and what people want from the Year of Culture. And we're ready to listen and capture everybody's recommendations. So that is all. Thanks so much for allowing me the opportunity to pester you all to be involved and to pass on the message.
Thanks very much. Thanks very much, Matthew. And the email was sent out, I think it might have been last week or even the week before. It was a while ago. But you've got the Eventbrite link now if you want to go on there and have a look which ones are available. And it's great to be involved in something that's fun and positive and not all doom and gloom, which COVID has been for a long time, hasn't it? So I'm sure that would be very welcome. Thank you ever so much. Does anybody have any questions for Matthew or Darsha or Steve before we round up? No? In that case, then thank you very much to everybody for attending. This was the last scheduled meeting, so you haven't got any more in your calendars now. We will be sending them out in May, July, September. Just a quick one to round up and make sure you're all okay and you're doing fine. The COVID Community Champions email is still open. We still want to keep in contact with you. So if you've got anything to share with us or you want us to put any special events or information on, do get in touch and we'll do our very best to do that for you. So thank you, everybody. Have a lovely week and see you when we do.
Thanks, bye.
Thank you.
Bye.
Thank you. Bye-bye.
Thanks, Tracy. Bye.
Bye.